This is an excerpt of a joint meeting of the Mendocino County Board of Supervisors and the Mendocino County Employee Retirement Association, or mcera, held on April 28, 2009. The meeting was recorded by and is available at the website of Ukiah Valley Community TV. We produce this excerpt. Some very important core questions about the State Controller's Office are posed in this excerpt.
I think this is important because, again, as I mentioned, we're going to try and hit a couple of items for you and for your constituents that have come up recently that we want to provide some answers for. There was something in the newspaper a couple of weeks ago about a high level of earnings on retiree health that was much higher than the earnings on the pension system itself. I hope that you can see from this. Let's say this is kind of an impossibility. That is an impossibility. It's not how the system works.
But that's what was stated in the reports, I believe.
In what report?
I need to set the stage for you to understand the following discussion. Mendocino County Supervisor McCowan organized a meeting in March with himself and another county supervisor, the present and past Retirement Association administrators, and myself, John Dickerson of YourPublicMoney.com. The meeting had several purposes, one of which was to discuss a number of concerns that came out of my analysis of Mendocino's financial reports. A moment ago, Mendocino Administrator Anderson referred to something in the paper. This was an article I wrote that appeared in the Ukiah Daily Journal on April 19th, a week before this joint meeting that you're watching. The article was my report of what happened at the meeting in March. Part of the article reported what happened when I asked why past Mendocino audited financial statements were so incorrect. I'll read a section of that article that initiated the discussion you are about to hear. Quote, Mcera's financial statements from 1998 through 2002 show mcera's pension and retiree health care funds separately. They're combined from 2003 on, but something's very wrong with the 1998-2002 statements. For example, the health care fund started in 1998 with $1.7 million of assets and made a $6.7 million investment profit. The pension fund started with $132 million of assets and made a $6.2 million profit. I asked, how did healthcare earn 375% on beginning assets, but the pension fund only 4.6%? Former Mendocino Administrator Tim Knudsen said, Mcera totals in those 5 years are correct, but many of the pension and healthcare fund values are very wrong. He could not explain why. And that's the end of the quote. Tim Knudsen, as I say, is the former Mendocino Administrator and Mendocino County Treasurer. Supervisor McCowan, who was in the March meeting and organized it, now asks this question.
Seemingly the rate of return on the health benefits was far higher than on the retirement. I mean, that did show up in either the audit or, one of the reports. The question that you're raising and the confusion arose, I believe, over one of the audits. That was a document generated by the retirement board that raised that question. So if you can explain how that came about, that would be great.
We will.
Okay, I can give it a tip. Over the years, we've tried to comply with all the different entities that we report information to. We have to give information to the state controller every year. We prepare an audit report that is regulated by GASB and the AICPA, the Association of Certified Public Accountants. And for a number of years, our auditor, Jim Sly, attempted to report the connection between retirees' health insurance portion of our assets and the assets that are being reserved for paying regular benefits. And there is a lot of confusion on how to do that. And for a number of years, Jim Sly separated out the amount of money that we had reserved for health insurance, and he tried to show how we arrived at that amount of money by factoring our returns, factoring part of our contributions, trying to do the best he could to comply with the state controller's directions and to include that in his audit. And it just didn't work. And we've had that discussion over a long period of time with the state controller's office. They want us to handle the health insurance in a certain way, and we can't really do that and keep our records accurately. So we've been dealing with the state controller for many, many years on that. And again, there was a period of time where the auditor tried to show how the amount of money that's been set aside for health insurance was arrived at, factoring some things to come to the bottom line. He no longer does that. It was just a difficult task to do. He has since contacted GASB, he's contacted the AICPA, he has a peer review group that has told him, don't do what you were doing before, just treat it as if it's part of the overall benefits paid to your retirees. Don't segregate it in any way. So there were a number of years where he was trying to do some things, we were trying to help him do the things to comply with the reporting requirements at the time that we no longer do.
Well, and I don't want to belabor it, and we won't resolve it today, but we do have a situation apparently where the state controller's office is asking for a breakout between what's related to health care and what's related to the retiree benefits, and we say, well, gee, it's too difficult for us to do it, so we're not doing it.
No,
I would hope we'd come up with a method where we could show that breakout. And it could be as simple as you just prorate the investment return between the two categories.
It's actually the direct opposite of that. The state controllers wants us to consider that we have no health insurance payment coming out of our retirement system. We have a report that we just fill in the blanks, and we try to fill in the blanks according to their instructions, but when they try to tell us to not include over $4 million that we pay for health insurance, act like it never occurred, we have a problem with that. So I've been working with the state controller saying, you show us how to do this, how to report this. Our change from the beginning of our assets at the beginning of the year and the assets at the end of the year without considering that we made a $4 million payment, we'll be glad to do it. And they haven't been able to do that. Solved.
I think on a larger scale, I know the position the Board of Retirement is, and certainly from a staff standpoint, is we don't feel like we have anything to hide.
Okay, timeout. If mcera has nothing to hide, then why do they commingle the pension fund and healthcare fund on their financial statements? They don't tell you the balance of each fund. They don't tell you the return on investment for each fund. They don't separate pensions and retiree healthcare payments. It's all one lump sum called benefits. Now, the county and the Retirement Association have said for years that retiree healthcare benefits have been paid out of pension fund excess earnings. Based on my analysis, I don't think so. I believe much, if not most, of the funds transferred from the pension fund to the healthcare fund were not in compliance with the 1937 County Employees Retirement Act. But I can't tell for sure because Mendocino's financial statements totally combine all activity and balances related to the two funds into one consolidated statement.
We welcome the meeting here. There clearly are some areas of misunderstanding. This is one. That's one of the reasons why we're there. In county government, I hope everybody can appreciate it. Is we get a state controller's, we get a disc that you plug into the computer, and the state controller asks for certain information, and it's got little boxes to fill in. And frankly, they can't work very well outside of those boxes. And we look at those boxes and we say, those boxes don't accurately reflect our economic activity, our accounting activity. How do we reconcile the two? So what's been happening is for probably a 3 or 4 year period, we've been working with the state controller's office saying, we don't feel comfortable filling the report and leaving financial information out, and we just can't seem to find a way to fit it in here that's satisfactory to you.
That's the end of the part of the meeting about the state controller's office. Mendocino officers made a number of serious charges in this excerpt about the state controller's office's effect on their public audited financial statements. They said that SEO requirements have forced Mendocino's public financial statements to contain very significant errors. The state controller's office told Mendocino to not include payments of retiree health care benefits on their audited financial statements. They say that they have tried for years to get the state controller's office to see these problems, but SEO persists in maintaining these flawed requirements that seriously affect the accuracy of their public audited financial statements. Now, Mendocino officials made these charges in public and directly to our county's Board of Supervisors. Isn't it fair for concerned citizens of Mendocino to ask the state controller's office, are these charges about you true?